My name is Udupe Coker. People call me Dupe for short. I'm director for the Center of Clinical and Translational Research in the School of Dental Medicine, University of Pennsylvania. Our microbiome is an ecosystem of people called good bugs and bad bugs. And what can we do to keep it healthy? We can definitely do a lot. We can have good oral hygiene, typically brushing and flossing twice a day. We can have good diet, focus on healthy, nutritious foods filled with fiber and nutrients, not sugary diets. We can also visit the dentist regularly, typically twice a year. So these are things we can do. And people have also talked about things like rinses and mouthwashes. Absolutely supported. It depends on what you need. And it's always good to get advice from your dentist. Typically twice a day. You should also be seeing a dentist or hygienist for regular cleaning. The microbiome is central to health. So having regular prophylactic cleaning is central to keeping a healthy microbiome. Mouthwashes are different from antibiotics in that antibiotics really are systemically targeted. It affects both harmful and beneficial bacteria across all body sites. Mouthwashes act locally and temporarily in the mouth. You have things like antiseptic rinses that can help lower the bacterial load. We have, different localized rinses. But you can basically think of the mouthwash or rinse as an adjunct, not a substitute for brushing or flossing. And so you need to kind of be asking your provider, your dental provider, about what you need. Now, antibiotics is also prescribed by your provider, either the dentist or physician, based on your needs as well. So they're not replacing the other, right? They can be used together in tandem. The mouth rinse could be an adjunct to what's needed for the antibiotic prescription. Having a weak or challenged immune system affects oral health in several ways. Affects the oral microbiome, affects salivary flow, affects the kind of way we fight against existing bacteria, either good or bad, right? Our immune system works in partnership with the bacteria ecosystem in our mouth or all over the body. So the immune system is constantly sensing and responding to invaders, either those who are commensals, meaning that they just live with us, or those who come to destroy or pathogenic bacteria. So when the immunity is weakened by conditions such as HIV, diabetes, cancer treatment, or when simple stress, the balance tips. The balance between the good bugs and the bad bugs will tip. And so opportunistic infections will come in. They call it opportunistic because they just take opportunity and they take advantage, leading to disease. So immunocompromised patients are at risk for a change in the microbiome and should be monitored regularly. We can turn all the science we've learned about the oral microbiome into practical steps by requiring or asking patients and care providers to recommend brushing twice daily with a fluoride toothpaste. It will help disrupt the biofilm that accumulates during the day. Another thing we recommend is interdental brushes or flossing regularly, at least daily. And then we recommend infrequent or limited sugary exposures, like preventing sugary diet and focusing on nutritious food like those with collagen, with calcium, and with high nutrients. We also recommend having a balanced diet, drinking lots of water to help with salivary flow and to maintain a balanced microbiome. Ultimately, seek help from a dental professional provider. Always don't skip your dental visits. Don't ignore them. Attend and keep your appointments with your dental provider. Absolutely matters because the oral cavity is a central part of the body. It's the beginning of the gastrointestinal tract. You swallow about a liter of saliva every day. And if you think about the oral cavity, it is home to a casing, which is the enamel, that's the hardest, one of the hardest bone structures of the body. So anything that's able to destroy a hard bone structure, any bacteria or biofilm that is strong enough to destroy it, should be something you should be paying attention to. And many times you also see things in the mouth that signal a bigger problem systemically. So having an integrated system does allow for there to be better care. It also lowers costs. It improves the quality of life for everybody who is seeing the dentist and the medical providers. Integration is really key to having a wholesome health system beyond just looking at the mouth and the body in silo. Again, the mouth is not different from the body. So integration is really key to overall health.